name is Biagio. I'm a physical therapist and owner of Elite Physical Therapy in Kansas City, Missouri. I would describe MovNat as a comprehensive floor-to-ceiling three-dimensional movement system that incorporates levels of adaptation and movement that are not seen in any other system I've trained in. Well, there really is a lot of transitional overflow into the rehab community. There's actually a lot of crossover and implementation of philosophies of PNF, which is proprioceptive neuromuscular facilitation, and then NDT, which is neurodevelopmental technique, within the MovNat system, even if it's not labeled that way. A lot of three-dimensional training and transition from supine to sideline to all fours to tall kneeling to half kneeling to standing, and it's just a great carryover and transition into what we're already doing. We're already implementing some of the techniques I teach a balance class, and there are range in there from people in their 50s with neurological conditions to people in their 90s who have balance deficits. And we will use a walker over a 2x4 or a 2x6, or we will use a tripod transition movement with hand position on a chair that's inclined. And so we're using a lot of the principles already. This just helps to kind of fine-tune how we're implementing some of them. And then the higher level techniques, some of the level 2 movements and activities will be perfect for some of our higher level clients. Certainly some of the climbing techniques, which are mostly new to me until I started training MovNat, are a big deal that I think have been left out in a lot of the way that we coordinate some of our higher level athletes, but also some of the crawling movements, higher level balancing activities. All of those could be incorporated and are really left out, because even higher athletes, a lot of times when you take them down to basic movements, are deficient, and so we want to make sure that we're correcting all those deficiencies before we transition them into extreme or into elite movements. It's great having the different components of the certification involving both written material, the physical proficiencies, and coaching techniques and feedback that we're getting from the instructors. I enjoyed getting the manual prior to the course. We were able to study the manual and the videos before, so we kind of knew what to expect already. And the material was organized in a fashion that was easy to follow and easy to both construct and deconstruct for the population that we work with already. I tell patients all the time, I shouldn't ask you to do something that I can't do. And so if I can't do whatever the movement, activity, or exercise is, I shouldn't expect my patient to be able to do that as well. Now, there may be something that I struggle at for one reason or another, but it should be something that I become proficient at if I think it's valuable for a patient. But probably my favorite thing about it was practicing the actual movement efficiencies and make sure I was doing well with those things. I'd highly recommend it, and I hope to have some of the MovNat instructors come to my practice at some point, and to have all the therapists, at least in our office, trained at some point.